Yes,
TAMP.
Uli. Yes.
Yeah.
Glad to
David
be
Uli
here.
is
Thank you.
former Harvard University and Indiana University Medical Center. He was also working at Fidelity, Worldcom, 10 startups and 2 exits. I hope the other 8 are on the way.
Yeah, some learning experiences along the way.
You know, 9-figure lifetime deal involvement, lived and traveled to 45 countries, adjunct professor at Shanxi University, China, and fluent in Mandarin speaker. Welcome, David.
Thank you, Lee. It's a pleasure to be here.
Tell us what you're doing.
Yeah, so we are with TAMP. I'm the CEO of TAMP. I started out, as you mentioned, in Indiana University Medical Center as a medical center administrator. I like to say in a previous lifetime. Then had a chance to build some startups, the first AI, the first fintech, the first e-commerce company. Brought us up to a couple of years ago when a group of doctors got together. We've since grown to a core group of about 10, extended team of 80. And we are solving serious pains in healthcare, many that have been discussed here today. But one of the #1 pains that's been overlooked has been identified by the World Health Organization, WHO, the CPME, the Standing Committee on Doctors in Europe, the European Commission, and others, is doctor upskilling, doctor digital skills, and healthcare professional digital skills. We have 10 million doctors globally, 30 to 40 million healthcare workers, and TAMP has come together with this diverse global group of experts to provide digital innovation upskilling programs. Now, we have essentially developed, created the future, created the core competencies, created the digital literacies, the DQ, the digital intelligence. And what we do is we bring in doctors to share their real life experiences with other doctors in these DIUPs, such as a digital surgery program that's coming up next month that we're working with Innovator MD here and hope to offer to members. It's together combining high-tech surgery and digital health innovation for a digital surgery program. And again, these are surgeons sharing their real life experiences. We're then able to move in with those certified doctor innovators. We're able to move into better engaging patients through corporate employee wellness programs, because patients are experiencing a lot of the similar pains as doctors with digital health technology. They have wearables, they have all this data, bring your own data. They want to get the data to the doctors. They want doctors with digital skills that are able to interpret and analyze that data. They want hospitals, healthcare institutions are able to integrate that data and do something with it, and to co-create and to co-manage a holistic approach to health, wellness, and well-being, shared decision-making, leveraging that digital health data. We're then able to move into adopting these digital technologies. We've got a barrier to the adoption of technologies. This is a $1 trillion industry. Again, it's not about the money, as was mentioned earlier. It is about health and wellness. It's about holistic health of the patients, improving patient care delivery and outcomes. And we're able to do that by overcoming these barriers to the adoption of technology by putting the doctors first. So the doctors are at the point of care. The doctors are naturally, historically innovators, and they're able to adopt that technology. And then finally, we move into innovating. So as Innovator MD, the many innovator doctors here, we're able to co-design and co-create with those doctors, and new technologies will emerge out of that. There's greater diffusion rate, greater spreading rate, greater adoption rate of those technologies when, as you know this very well, Leah, when the doctors are involved in that technology. And it's about doctors sharing real life experiences. They don't have a lot of time. They need the digital skills, and doctors can share, hey, this is what worked for me. This is what I trust. This is how this is how this is applied, and how it will really, as was mentioned earlier, not about the money. It's about how this will improve the patient care delivery and outcomes. And that's really what it's about. And it's about developing these digital literacies for doctors and healthcare workers. It's about developing the digital intelligence, digital quotient, whether that's extended reality, XR, AI, all this kind of alphabet soup, wearables, Internet of Things, Internet of Medical Things, blockchain, 3D printing, bio 3D printing. So there's all these areas that are just being thrown at doctors. They need to be able to better navigate this digital VUCA environment. And that's what we do. I know it's a lot. It's a big, audacious goal, massively transformative purpose, but we love it. And, we feel we're making a positive social impact globally. So thank you. It's a pleasure to be here.
Great, great. So is this a physical facility, or is it more all virtual?
Yeah, we've gone virtual like everyone else. When the world went virtual this year, we had been doing this many years prior, and we were just very well positioned to be able to offer these types of digital innovation upskilling programs. So it is virtual, and we're very global. As you mentioned, I've lived and traveled to 45 countries. I was a professor in China, got a place in Taiwan. We have locations in Japan and India. I lived in Europe. So we're very global. And I'm traveling now. I'm actually in Asia, traveling to our locations here. So yeah, we want to be very global. We were global really from day one, which is what you have to be now and in this world. And yeah, we've been naturally virtual way before all of this happened. So this has been something we've seen coming, for many years. But as everyone knows, the pandemic accelerated going virtual, and hospitals and healthcare institutions adopting the technology by at least 3 to 5 years. So we've accelerated. We knew that acceleration was accelerating, and the digital technologies were converging. So we see ourselves as a 100% global virtual organization. Absolutely.
If you had to give a title for your organization, what kind of an organization is it? Is it like an accelerator, or is it more like an educational piece, or is it like a network? What is it?
Yeah, that's a good question. When we started out, a lot of people, we're kind of looking at this and asking, is this more like a doximity, a doctor community, or something like that? There were a lot of doctor communities out there. There were a lot of medical skills applications, a lot of medical skills, continuing medical education, things like that, already available. And we wanted to focus on the digital upskilling, and we wanted to give doctors, so it is really an end-to-end kind of solution. It is going from first changing the mindsets. So we believe that it's important to change the mindsets of doctors. So we begin with the digital innovation upskilling programs, changing the mindsets of flow, design thinking, something called synarchy versus hierarchy, exponential thinking. So we have to change the mindset. Then we can move into the upskilling programs. So those are an integral part, the digital literacy, the digital intelligence. After that, those certified doctor innovators are able to move into then co-designing and co-creating themselves together with our partner providers. So that part, some people, compare more to like an incubator, an accelerator, because we do have a large investor network. We're able to bring in the investor for these projects. And then we're able to move into our marketplace on the blockchain. So there's a huge demand for marketplace, digital health marketplace that's trusted by doctors. So we really believe in covering, three areas: digital upskilling, number one, the digital innovation platforms, and the marketplace. So there are really three different areas that, in this new world, you've got to combine. It can't be done, in isolation. So it's really those three areas that we've combined into this total solution, if you will.
Great, great. So if somebody wants to join you, or if somebody wants to engage with you, how would they do that?
Yeah, so we're naturally virtual. We've been across dozens of networks. You'll find us nearly everywhere. I've lived my life virtually online. I was one of the first on LinkedIn. I think that's where we met a few years ago. I was one of the top 10 on LinkedIn the day that it began. They used to list back in the old days. They used to list the top 10 people. So you can find us.
You don't look that old, man.
Pardon?
You don't look that old.
Yeah. Well, LinkedIn's only been around 20 years, so I'm not dating myself too much. But you can find TAMP, T-A-M-P. TAMP is the company, just simply TAMP. Our digital health innovation platform is AMP Doctor, A-M-P-D-R. Now, we only work through medical association alliances, other associations like Innovator MD exclusively, and through healthcare institutions and hospitals. So you can't just access it. You have to be part of this alliance or membership. But you can find us under ampdoctor.com, A-M-P. So it's like amp it up, get amped up, ampdoctor, ampdr.com. And you can find us on any messenger, any network, business network, social network under either TAMP or AMP Doctor.
So is it only for doctors, or are you also looking at startups and technology companies?
Yeah, that's a good question. We began with doctors. There are 8 to 10 million doctors. The next crucial area is, healthcare professionals, nurses and others. There are 30 to 40 million. Then we move into patients through our corporate employee wellness program. Those doctor innovators, as I mentioned, are able to then solve those serious pains of the patients. So obviously we have billions of patients, but we do bring in hundreds of carefully selected technology partner providers that we've worked with for many, many years. And those partner providers, they have to remain completely objective, kind of like you do with a CME, but they do help us to co-create the content. And then they work, we match them up. Doctors can select them with an idea or project, or those companies can reach out to the doctors as either paid advisors or to co-create sometimes a new startup or a new digital health product or services. So we bring in those partner providers to work together with our doctors in this ecosystem.
Great. Well, I'm glad you were able to join us today and give us a little preview of what TAMP is doing and how it can help our network.
Wonderful to be here.
I like you're thinking about how the whole ecosystem needs to support each other, so that when the tide rises, it'll take all boats with it. So that's a great philosophy that you have, and thank you very much for participating. Please leave your contact information in the chat box. That way people will be able to contact you, or your LinkedIn.
Okay, absolutely. I will do that. It's a pleasure to be here. Wonderful summit, wonderful organization. Love the work you're doing.
Thank you. Thank you.
Thank you.
All right, let's move on to our next partner. By the way, at 3 o'clock Pacific time, we're going to start our startup showcase. That is the exciting part of today is, you get to see these innovative companies doing innovative things. And, obviously there'll be people who are watching, would be from the ecosystem, and some of them will be investors. So I am very interested to see our judges looking at these and how do they evaluate these startups, and give us a preview of their thinking.
It'll be great to see. We are also investors, so large investor network. So I'll be eager to see and see who we might be able to partner with in this startup showcase as well.
Yes, yes. Great. Thank you.
Thank you.